I'm one of the child life specialists at Children's Hospital of Pittsburgh, along with Sarah. And we really wanted to come today to kind of talk about different techniques that we use with the patients in the hospital, regardless of diagnosis, and really different ways to empower you as parents and as family members of different techniques to use with your kids, with other family members, siblings, because we know that we're lucky enough to be a part of a very large child life department at Children's, but I know people are coming from all over, so it varies as to what departments are like. Just a feeling in the room, who is familiar with child life in general? Okay, so a pretty good amount. One of the things we wanted to start with is just like a little basic overview in child life. In our field, we really focus and aim towards providing children and their families with therapeutic support. We know throughout a hospitalization or a medical experience, there are lots of different people that you come in contact with, the kids come in contact with, the medical teams, and we really focus on that social, emotional, therapeutic side of things. So today we're really going to look at some of the different supports that we offer, some of the different techniques we use, and different ways that you guys can do those if we're not around. One of the first things we always kind of begin with when we start talking about child life is the hospital can be scary, and that is just a fact. There's no way around that. I always turn to that top picture as just kind of sums up the experiences that kids sometimes have. I hate everything here, and it's truthful, and it's honest, and it's okay. And we want to work with kids and, look at that perspective and help them through it, because that whole list of things, unfamiliar environment, potentially miles and miles away from your family and friends, surrounded by strangers, tons of different changes going on in your body, your schedule's flip-flopped upside down. Sometimes kids might be used to lunch and recess at school, and they come to the hospital and they're put on an NPO status and bed rest, and their world's flipped upside down. And so we really want to not ignore these feelings and these fears and concerns, but address them and work with the kids, work with the family members, and talk about them. That this is not stuff that needs to be pushed down, put in the back of your mind. It's not scary. This is what we have to do. It is scary, and let's talk about it. Let's figure out ways to cope through. So some of the different things that we do and that we really want to impart onto you guys and help to allow you guys to use in the future are preparation, distraction, stress point coping, and then one of our huge beliefs in what we just finished up doing is play. That outside of a hospital, a child's main job, regardless of age, diagnosis, medical history, their job is to play. And there's no reason that when they're in the hospital that they can't do that. If they're feeling up to it, go for it. Get out of bed, play, let's do your favorite things. And so we really focus on that aspect a lot. We get paid to play, and we love it. So one of the things we're going to start with is preparation, which is a big one and something that can be done at home before even coming into the hospital and can help kind of alleviate some fears before you even get there. A lot of times people say, why prepare for little kids? Why would you do that? It makes them nervous. Forget about it. Just tell them you're going somewhere and just drive to the hospital instead. We don't like that thought. We want to prepare. We want to include them into these conversations and let them know what's to come. Give them a sense of control. We know a lot that goes on in the hospital is completely out of their control, and they don't get a say-so in what goes on. And so we want to bring that control back and talk about what's going to happen, what it might be like, what other kids tell us it's like. Some of the best ways to illustrate this are just through some stories. One of my favorites, something as simple as getting an IV. That it happens a lot, probably almost every admission, blood work going on. And we've had kids who said, I don't want it. I don't want them to take all my blood. How can I live if they take all my blood? And that's their perception of what's going on to get blood work done. And we want to talk with them and go through the steps of first they'll clean your skin, then they'll put the straw in and let them feel the straw, let them touch it, and really understand, how much blood they're going to take, what it's going to be like, what it might feel like. Talk to them about it before and kind of clear up those misconceptions. Coming into the hospital is stressful, and it causes a lot of anxiety, both on the kids' parts, on the parents' parts. And so sometimes it's very helpful to do preparation family-centered, have everyone involved, parents, kids, patients, everyone. Let's talk about it beforehand. What are some things we're going to expect? A lot of times with preparation, in our field, we like to focus on the 5 senses and using what are things you're going to hear when you go, what are things you'll feel, what are things you'll smell. Just go by the senses and get the conversation going, even if it's at the dinner table a couple nights before, starting to talk about the different things. Another story that I use is with surgery. Getting your tonsils out. A lot of kids know where their tonsils are because they might have had a sore throat, and they know that they'll have to come out, but in their minds, we've been told, what are they going to do, slit my throat open? How are you going to get them out? Let's talk about it. Using that language, talking about the sleeping medicine and letting them know that they'll be asleep and really preparing them for what's to come so that you can learn about some of those misconceptions. We brought a couple of our different prep materials. We are switching to iPads, so we use our iPads a lot more. But we have just different prep books that we have pictures of all the different places in the hospital. Taking a picture of the MRI machine or the CT scanner before going to it. And if you can't get your hands on the actual one in that hospital, kind of look it up online, get a general idea. We call it a donut shape, and get an idea of what's to come. We use different teaching dolls. These are our anatomically correct dolls that when you kind of undress them, and you can see different parts of the body. If they're having surgery on something, let's talk about the actual part of the body that you're having surgery on, or when you're saying we're going to listen to your heart, let's show you where the heart is. Let's really talk about it and prepare for what's to come. One of the next things that we often focus on, and we rely on parents a lot, and parents can take a huge role in this, is distraction. Distraction, truthfully, is ageless because a lot of times the things that go on in a hospital are stressful. The procedures cause a lot of anxiety, and it's helpful sometimes to distract away from the here and now of what's going on. That list shows a lot of the different things we use for distraction. I Spy books. I Spy books are the perfect size that can be placed between what's going on and the patient's face to just kind of block it out and let them get absorbed in the world of I Spy rather than what's going on. And Sarah's greatly modeling it. Other things, bubbles, pinwheels, movies, music, all different things that you can come up with as a form of distraction. One of the big things we like to do with kids and that we encourage parents to do, come up with a coping plan beforehand. If you know something's coming up, a procedure they really don't like, a breathing treatment, something that they struggle with, talk about it beforehand and come up with a coping plan. Okay, when the nurse comes in and has to do the breathing treatment, what should we do? Should we put on this movie? Should we read this book? Have the plan, kind of gets them in the mindset of what's to come and what they're going to do during it, and go with it. Sometimes the plans don't work. Have a plan B, go for that, and just keep going, kind of helping them and even you remove yourself from the moment if possible. Sometimes it's hard and you might go through plan A through G and you just keep going and trying different things. Kind of what goes hand in hand with distraction is stress point coping. These are different skills we use a lot, but definitely something that we empower parents to do with their kids all the time because this is something you don't need child life around for. It's teaching kids different techniques to utilize at stressful times, which happen a lot during a medical experience and during a hospitalization. Some of the big ones are different breathing things that pinwheels, bubbles, stress balls, squeezing it. It looks a lot like we come in and, oh, child life, all they do is blow bubbles. Well, really, we're taking it a step farther, that it's opening up their airways. It's calming their heart rates. It's letting them relax by getting into those deep breathing techniques that if they're 4 or 5, they might not want to talk about deep breathing techniques, but they'll blow bubbles with us. So we'll do those different techniques, and we like to practice them with the kids before a stressful situation. If you're hanging out at home or if, they're just hanging out in the hospital room, let's do these different techniques of blowing away the pain, using the bubbles, imagining your favorite place to be when you're not stressed, so then in the moment, it's a little bit easier. I love to use with teens and adolescents guided imagery, talking them through their favorite place to be, again, using the senses. I like to go to the beach, and so talking about what the sand feels like, what the ocean sounds like. Close your eyes, go there. Get yourself out of that stressful situation in that moment and go there. I tell parents a lot, talk your kids through things. It's a lot of you're doing great, but go to that guided imagery. There's sometimes the parents go there just as much as the kids. As you're talking and talking, you get so into it that it ends up being kind of helpful for everybody involved. So kind of turning it a little bit, we're going to focus more on that play aspect. We in the hospital like to look at 3 different types of play: the therapeutic, the medical, and the developmental. All very important types of play. We talked before about how a child's main job is to play, and we really let that shine through all these different aspects. So we'll break it down bit by bit. Therapeutic, you can see that whole list of different things. It lets kids really express their feelings, expand their imagination, communicate with us. One of my favorite stories is kids who the frustration builds up in a hospital, and if it's a long admission, or even if it's not long but it feels long, and frustration and anger and missing out on things, it starts to build, and that's a very common reaction. And so we've done target practice in the room. You would be shocked how many Nerf guns our hospital owns. We have tons. So we will draw out the target, make the target, hang it wherever they want in the room, and a lot of times we'll work with the kids and have them list what is making you so mad right now. What are the worst parts about being in the hospital? Write it all over the target. Go crazy. Parents do it with us. Parents put their worst things on it too. The kids will list any and everything. I say, if you ever want to put the doctor's name, you put his name and hope he doesn't see it. And then put it all over the place and use those targets and shoot the Nerf guns at it. Throw wadded up tissue paper at it. Anything to kind of let them release that anger. Even kids who might still be on bed rest and are sick of being in the bed, they can still shoot that Nerf gun, or they can throw that wadded up tissue paper just to get some of that tension and stress out. And on the flip side, we usually then like to flip the target over and list the positive things that are going on here, just as a way to communicate and start the conversation of what's really going on. Other therapeutic things that we like to do, all about me posters. So often the kids are in the beds and the doctors or nurses come in, and it's so much just talking about all the medical thing and maybe talking right over them, or just saying, how are you feeling today? How was your night last night? Well, we want to let them share more, and we'll sit and create all about me posters. There is no right or wrong way to do that. All you need is a poster and some markers, and as a family, you guys can go to town on it and do what's your favorite place to go, your favorite thing to eat, your favorite thing to do, who's in your family, all those different things, and have the kids point to it. So, do you want to see my poster? Let's talk about it. Let's take it to that next level. So tons of different therapeutic types of play to really kind of let the kids empower them and express their feelings. The next one of my favorites, and what we just kind of wrapped up with a lot of the kids in the other room, is medical play. And some of these pictures really illustrate it the best. You should have seen the room downstairs. It was stuff everywhere. They were wearing masks. They had the surgical gowns on. It looked like total chaos, but we loved it. Medical play allows a lot of kind of clearing up misconceptions. That I think the best way to illustrate it, again, with a story, there was a patient who one of our colleagues worked with who he was a pretty lengthy admission, and he was in his bed and did not want to go anywhere. Medically, he was allowed to get up and go to the playrooms and walk around and play, but he did not want to at all. Stayed there. I don't want to go. I don't want to go. I don't want to get up. I don't want to do PT. I just want to lay here. Our colleague Mike worked with him a lot and did medical play and took all the equipment out, the actual medical supplies, let them get their hands on it. Sat with them with our little shadow buddies that we use all the time for medical play. And they did a lot of teaching with the IVs. And Mike brought out the actual IV, the catheter, the tubing, everything. And it wasn't until that moment that he looked at Mike and said, "Well, you mean the needle's not there?" And Mike said, "No, they threw that away. The only thing that's left is the little bendy straw. Do you want to feel it?" And he touched it and poked it, and he said, "Well, so then that means I can move my arm. If the needle's not there, then I can move my arm." And Mike said, "Yeah, you can move it all over the place." So, a lot of times you just think that, well, they must know. They probably saw us throw the needle away. They probably didn't. So let's talk about it. Let's play. He got up out of bed that afternoon and went to the playroom. He laid there so still because he thought if he moved, the needle would get him again, and so clear it up for him. Let him touch it. Let him feel the materials. We've taken these Shadow Buddy dolls. We've put ports in them, PICC lines, catheters, you name it. They sometimes turn out looking like little voodoo dolls, but we'll put any and everything in it to let the kids really get their hands on it and touch the equipment, feel it, learn about it. Ask questions about it. Sometimes they don't even know what questions to ask. When the doctors stand there and say, "Do you have any questions?" They might say no just because they don't know what to ask. So let's lay this stuff out for them and let them go to town with it. Another one is you can see the little picture on the bottom of the surgical caps and the masks, and that's a lot of what we did downstairs a minute ago. But it's scary sometimes in a pre-op area or walking into the OR when everyone's wearing the masks and the hats, and you can't see their faces, you can't see their smiles, and it's a bunch of strangers, and all you see are their eyes. So why not put Google eyes all over it? Draw faces on it. Have the parents dress up with it. Ask the OR nurses to put them on down there. Make it fun. Take the stress away from it. Allow these kids to take some control back. Again, what we said earlier, so much is out of their control. Let them get their hands on this stuff and go to town. At home, since we're talking about different ways to do this on your own, and it is hard to get your hands on all the medical equipment, but using different things, even if it's just Band-Aids and gauze and different things with the Fisher-Price medical kits, the stethoscope, starting with that at home. And then if you're in the hospital, ask the nurses for different things. There's no reason you can't play through some of these things with your child during their hospitalization or even at home. One of the last huge parts of play is developmental. That, it is completely natural for kids throughout a hospitalization to regress, especially if it's a lengthy one or if they've been pretty sick throughout the hospitalization. It's natural. Our job and what we empower parents to work with us closely is to strive to keep kids on track developmentally, still reaching those milestones. We know that's hard. I am based in the Children's Hospital, is in the pediatric ICU, and that's hard to keep reaching those milestones and be on the developmental track in that area. But doing what you can in that moment and allowing kids to still have those materials in their crib, in their bed, to play, to keep going, and not, try to avoid as much regression as possible and let them still really be kids. So what we kind of do to wrap it up, this is another one of our, pictures and stories illustrate it better than anything else. This is a picture one of our patients drew for us, and it sort of just shows that full perspective. It kind of all relates to "I hate everything here" picture. This one's labeled Dr. Evil. The image is huge, larger than life, 4 arms, sharp images. Everything's just a little bit scary about this. But it's truthful and it's honest, and it shows what they probably felt that doctor looked like or what the situation looked like. And we want to talk about it, let them draw these things. There's no reason they can't express this, but let's talk about it. Why do you think it seemed like he had 4 arms? Start the conversations going regardless of age. We want to, clear up those misconceptions and help them throughout their entire journey. So this is a little bit about specifically child life and working with the patients. I'm going to flip it over to Sarah, she works in our sibling center at the hospital, and she's going to focus a little bit more on the sibling perspective of things, and then we'll open it up for questions and comments once we're all finished. So we'll flip it over.
Hi, my name is Sarah+Miedel. I also work at Children's Hospital of Pittsburgh in the Child Life Department. So I am also a child life specialist, but my role, instead of working with patients, is I work to support the siblings of the patients. So how many of you out there have other children in addition to your child with ILD? Large majority of the room. How many of you have had questions or struggled or been concerned with how do I balance supporting my child with a chronic illness while supporting my other children who maybe are at home but are also healthy and developmentally appropriate? And that's a very normal, typical thing. And it's, to be commended that you guys balance that. It is very, very, very hard. So what I kind of wanted to talk with everyone today about was, some of the needs of siblings that they have. They have very unique experiences and thoughts and feelings, and that it's okay for them to have these, and just kind of cover, each developmental level, and looking at each developmental level of infancy through adolescence, like really how to tailor, helping your other children get through those different stages with regards to having a brother or sister that has a chronic illness. So just kind of wanted to start out with just a brief overview of a wide variety of feelings, thoughts, experiences that research has shown to have. Siblings have been documented to say they felt these things. So there's a lot of literature out there with regards to, what they're going through. And I think it's interesting to point out that a lot of times it's hard to kind of tease these out from each other, that sometimes one feeds kind of into the next, feeds into the next, feeds into the next. And that it's, to let them know that it's okay to feel these things, and that there are other kids, and that's one of the things we aim to do with the Sibling Center and our sibling support group is to, help them realize that there are other kids out there who, are experiencing these things and feeling these things as well. So, just kind of looking at that over-identification. You see this a lot of times, and we'll get to the preschoolers, with regards to thinking, well, maybe I caused my brother or sister to be sick. I was bad, that's why they're sick. I took their toy away, that's why they have to go to the hospital. Mommy or daddy is mad at me. Also, well, since my brother or sister, is sick, well, I must have been sick, or I'm going to get sick, or mommy's going to get sick, or daddy's going to get sick. So letting them know that, there are, that is something that is just for their brother or sister that they, that they're coping with, and it isn't something that they can quote unquote catch or can't pick up at school or things like that. A lot of times siblings feel embarrassment and shame that they feel different from their peers. And that's, again, to let them know that that's normal to, to feel that way, that they feel like, my soccer team, I don't have anyone else whose brother or sister is always in the hospital or who always has to go to the doctors. Or, I don't have, or the kids in my school, there's not someone else whose brother or sister, looks different or acts different. And that's okay for them to feel that way. And a lot of times as kids get older, as siblings get older, they feel that guilt associated with it. I wish I hadn't felt this way. I feel bad for feeling this way. I feel like a bad person for feeling this way. A lot of times they feel abandonment, not necessarily just from their peers, but also from caregivers as well. And that's nothing that is intentional, nothing that is, done consciously, but they, a lot of times kids on their developmental level it's difficult for them to understand why mommy or daddy are going with their brother or sister to the doctor's appointments or to the doctors or to the hospital. And that sense of, well, they must like my brother or sister more than me because they're always with them and they're always, staying with them at the hospital. And so we'll get into the, these different interventions and suggestions to help them cope with this. And really looking at that, that isolation and loneliness again. There's no one else that can understand what I'm going through. No one else feels this way. Mom is always here with my brother or sister, or dad's always here, or grandma or aunt, uncle, whomever. And just kind of this sadness, this helplessness that I have really no control over this situation. I can't make my brother or sister better. I can't make them not have to go to the hospital. I can't make them not get sick. I can't make them not have to go to the doctors. There's nothing that I can do to improve this situation. And a lot of times with regard to that lack of control and those lack of choices that they have, they feel anger over it, that, this really stinks that this is going on in my life, that I wish I could change this, but I can't. You a lot of times also see siblings be resentful and jealous of their brother or sister and the time, that parents are spending with them, that caregivers are spending with them. I can tell you a story. I've worked with siblings for over 4 years now. And there's one sibling in particular. She is 7, and I've worked with her since she was 3. And I would say about 2 years ago, Mom came to me, and she has an older sister who has a wide variety of medical conditions and developmental delays. And Mom said to me that the sibling expressed to her, I wish I would get sick so you could come and stay with me in the hospital. And Mom was like, what do I do with that? What do I say? Can you talk to her? So we really talked about, what it means to be in the hospital and what it means to be sick. And, yes, sometimes when you're in the hospital, you have visitors that come see you, or you get, different toys or prizes or rewards. But there are some negative signs to the hospital as well. When you're sick, you don't feel well. And sometimes you have to do things that you don't want to do or feel yucky and don't feel good. So kind of clarifying that for the siblings. We also get a lot of times siblings being confused because they're not knowing what's going on. And that's a lot what Jenny talked about with regards to, educating and preparing the patients. We can do that as well with the siblings. So all the interventions she talked about with regards to, using pictures, using teaching dolls, the words to use, talking about what's going to happen ahead of time, recommend that for the siblings as well, including them in that conversation and, including them in the preparation and education as well. Because a lot of times when kids don't know what's going on, we know that their minds wander and they make up these wild, elaborate stories. So, letting siblings know in a way that they can understand based on their developmental level, this is what's going on with your brother or sister. This is the tests they're going to have or surgery that they're going to have, or this is their diagnosis. That really helps to also alleviate their fear. When you don't know, and raise of hands, when you don't know something that's going to happen, who is scared or anxious about it? I can tell you that I am. So, kind of all rolls into one another. And just kind of the last thing to think about is, and we'll get with this with regards to adolescence, is kind of this pressure to achieve or these increased responsibilities that, now the siblings sometimes feel like they have to take on the caregiver role, that, I have to do this for my brother or sister, or I have to do these extra things around the house because my brother or sister aren't able to do that. Or maybe they recognize, especially as kids get older, my brother or sister might not be able to have this opportunity to, do these things that I have the physical ability to do. So therefore, it's, I feel more pressure that I have to live up to these expectations. So that's just kind of a wide variety of, siblings of chronic illness and kind of what they can go through and experience. So just kind of setting the stage for the next couple slides, just wanting to look at, developmental age versus chronological age. And as I mentioned, I'm going to talk about how to support siblings in each one of these different developmental levels: infant, toddler, preschool, and adolescence, and kind of the chronological ages that make up those developmental stages. But it's important to realize that not necessarily chronological age is identical to developmental level. That, some children may be delayed developmentally, and it's also natural for kids to, develop at their own rate. We're all obviously individuals and unique, and just because your friend's 5-year-old is hitting this milestone and your child who is very close to 5 hasn't, grasped the concept of being able to, tell time yet, doesn't necessarily mean that there is something majorly wrong. It's just recognizing where each of your children are, and where to work with them on their developmental level. So kind of looking at infants, I think it's pretty self-explanatory that there's not going to be a whole lot of preparation and education that's going along with infants, that their cognitive capacity to understand things is obviously, we're not going to be talking with them about how the lungs work and how the body works and showing them teaching dolls and pictures and things like that. So with regards to infants, what we really want to focus on is being able to, maintain their routines as much as possible, and to be able to maintain the things that they need the most. So the food, shelter, security, love. And I know that's difficult a lot of times for parents when they are separated from their infants, because, parents are, the attachment figure and the caregivers for infants. So what can we do to make sure they're still getting their needs met? One of the major things is to, if much as possible, designate one alternative caregiver to provide stability. So it's not, the infant's not going from one person to the next, and from one routine and environment, because really we know kids thrive on routine, they thrive on schedules, and that's especially true for infants. We're setting the stage for them to get into that routine and that schedule as much as possible. So that's, what we want to have that ability for them is to experience an attachment and be able to form an attachment with someone. If there is a separation from your infant child while you're caring for your other child, we talk a lot about different things to still help you feel connected and help your infant child feel connected to you. So technology is amazing these days. So it says utilize multimedia resources. So as Skyping, pictures, those digital or those recordable storybooks that Hallmark has, just so that your infant child can hear your voice, can see visual representation of you, just to make sure they feel that connection. Recording a CD, recording a song, different things like that, video on an iPhone or an iPad. Another thing that's really important is designating a comfort item. So maybe a clothing item that has your scent that you can leave with the infant, so that when they, are fussy and they still, have that connection, and they can still have that sense of comfort and, feel like mom or dad are there and, actually smell mom or dad being there. So looking at toddlers. So toddlers are the nice little transition from infants to preschoolers. So, they're, again, starting to develop their different cognitive skills. They're starting to obviously speak more in sentences. They're starting to understand more. But we know toddlers, as much as they want to be independent and say no, that's their favorite word, they still have that dependence on adults for care. And toddlers also are it's very hallmark of them to be fearful of strangers and fearful of mom or dad leaving and that abandonment. So what, you're going to see the kind of pattern through this is that maintaining routines as much as possible. So, designating a caregiver for them, letting them know this is when, my child eats, this is when they go to sleep. So it is when that disruption in routine happens that we see behavioral changes and kids really affected by it. So being able to maintain that structure for them all throughout the developmental levels is really, really, really important. We also, can start using language to explain to the toddler, very basic, very simple, but using words with regards to, medical terminology, medical names, diagnoses that they can understand. So again, very simple, very basic, not obviously, we're not going to go into, this is your heart and it's going to pump blood all throughout your body and all of these different things, but again, what they can understand, and incorporate real and medical play equipment in the medical play session. As Jenny talked about, we can use medical play with the siblings as well. So with toddlers, it's great because we can use those Fisher-Price doctor kits. They're so much fun. They're really into those. And also, very safe medical equipment. So we want to make sure nothing, obviously, that they're going to pop into their mouth and choke on. We have to be careful of that. But getting them that familiarization with a hospital, and this can be done at home. It can be done in daycare, in the Sunday school. It can be done in the hospital when their toddler's there with you. So really incorporating them as much as possible with the patient as well. Also starting to use storybooks with familiar themes and characteristics. So as I mentioned, toddlers, one of the things they experience is that separation anxiety and stranger anxiety. So really looking at books that address, having that separation from a loved one. I recommend a lot The Kissing Hand for parents. It's a great book. Also, The Invisible String is a really good book too for toddlers and preschoolers. Just really, helps them understand that theme of when someone isn't here with me physically doesn't mean that they're not thinking of me and they don't love me. And so to really understand that connection that someone's still there. Also with toddlers, this is where we get into that over-identification I was talking about, letting them know that they didn't do anything wrong. We all know that toddlers like to get into things, and there's a lot of them starting to learn discipline and, right from wrong and yes from no. So assuring them that, it wasn't something that they did that they were bad or that they caused it, that their brother or sister to be sick or have to go to the hospital, or for mommy or daddy to have to go with their brother or sister, that is not something that they caused, so to speak. So next, kind of looking at preschoolers. So we know, again, as we get through each stage, starting to understand more, starting to have, more advanced language. The thing with preschoolers is basically what they see is what they think the world is. So it's literally black and white for preschoolers, which is really fun and really cute because when you tell them something, like we tell them a joke, they just don't get it. Or so I absolutely adore preschoolers. But with regards to preschoolers, because of having that so black and white, they think that because this is what my brother or sister's going through, that therefore I probably went through this, or I'm going to get sick, or mommy or daddy, or whomever. And so that's really important, again, to understand to let them know it's not something that they caused, it's not something that they can catch. Again, just letting them know that how they are different from their brother or sister and how they are special from their brother or sister. Again, with preschoolers, as with any child, providing as normal an environment as a routine as possible. Again, looking at starting to use names, terms, words on their comprehension level. So again, their receptive and expressive skills are, advancing. So you can explain things a little bit more in depth with a preschooler than you can a toddler. And with a preschooler, you can do a little bit more talking and a little bit more explanation. And so you can incorporate a couple steps into that process. So it's important when you're talking about those steps that you do things one at a time, that it's not all at once. Maybe give them a break when you're talking about it, incorporating it, discussing with them during a play session. Because when you sit a preschooler down and say, "Mommy wants to talk to you," they're done after about 30 seconds. So I always encourage parents, when you want to speak with, when you want to talk to your preschoolers, do it with them when you're playing with them, when you're coloring with them, when they're, engaged in an activity that they like to do. And, obviously the conversation's not going to last a whole long time, but then you can break it down into kind of the steps and what you want to say to them. And so the next time, then you can talk about with a little bit more with them, and the next time a little bit more with them. Again, using these visual props, so pictures, real medical equipment, teaching dolls, Dr. Fisher-Price doctor kits, all of those kinds of things, go along with preschoolers. They love to see things and explore things. We know that kids learn through play, and again, it's so critical for kids to be able to have this control over these things that they don't have a control over other situations in their life. So. And again, just incorporating, medical equipment and medical play as much as possible. And then looking at school agers, and I can tell you that personally school agers are my favorite age of kids to work with. So I really like school agers. So they're so much fun because they are starting to get into that ability to understand abstract thought. You see school agers, the 6 to 11-year-olds, starting to tell jokes, starting to get good sarcasm, I should say, not bad sarcasm, starting to understand, jokingly teasing, things like that, starting to understand logic and cause and effect. This is when kids start to, learn math, some very more abstract math, tell time, et cetera, et cetera. And the fun thing about school agers is this was when they're really starting to get into how the body works and why it works. They want to know exactly everything that's going on. You show a school ager a picture of the inside of the body, and they're like, "That is so cool." So that's what's really fun about this developmental level, is that they're able to start to understand that and to see how all the different things are connected, the organ systems in the body, and how each thing really feeds into each other. The other thing about school agers that's interesting is they're really, really into making sure that they still get to do the things that they consider quote unquote normal. They want to be able to make sure that they still get to go to soccer or dance or gymnastics or ballet or hockey or baseball, because their peer group is so important to them at this point in time. And especially same-sex peers, that's 6 to 11-year-olds. That's when, boys have cooties and girls stick together. So they're really into, hanging out with their girlfriends and, playing Barbies. And this is when they start to scream over the teen idols like Justin Bieber and One Direction, all those fun things. So with the school agers, because of this ability to, really start to understand abstract things, we can start to use more and more and more of the actual medical terminology, but couple that with an explanation that they can understand. So say the word of, the diagnosis, say the word of the test or the surgery or the medical equipment, but explain it to them. This is what the doctors or nurses call it, and this is what it is. Provide opportunities for preparation and exploration of the hospital. So we start to incorporate sibling support groups at this age group, letting them go and tour different areas of the hospital, letting them to get to meet all of the different people associated with their brother or sister's treatment. So this is, Dr. So-and-so, and this is what he does. This is, the occupational therapist, and this is what she does. This is this physical therapist. This is what he does. This is the child life specialist. This is what she does. So letting them understand all those different roles and responsibilities that, and all these people that are in their brother's or sister's life. And it also helps them feel that connection and helps them form relationships with them as well and feel incorporated and part of the process. Also working on their misconceptions. So again, letting them know, what the reality is. Asking them, what questions do you have? And if they have questions or what do you think about this? And that's a lot of time what I suggest to parents is, when talking with their school agers, saying, when you want to start talking about something, say, well, what have you heard? Or what do you think this is? And finding out, what they're thinking and feeling and going from there and clarifying those misconceptions as much as possible. And kind of, to wrap up school agers, as I mentioned, they're really into their routines and their activities. So to maintain their structure and letting them know who's going to help them take care of their different needs. So if mom or dad aren't going to be here to take you to soccer practice or take you to basketball or take you to this or go to your dance recital, who is going to help do that? It's, it might be grandma, it might be Aunt Susie, but just letting them know that as much as possible that they're going to still do these things that are so important to them so they don't feel that disconnect from their peers. And then lastly, looking at adolescence, which is a whole other ball game, that nice transition between school agers and adulthood, which I said are pretty much like basically grown-up preschoolers because they're still in that, it's like the all about me stage, but they're just 16 instead of 4 years old. So with adolescents, they're really focused on the here and now. And how's this going to affect me? How's this going to affect me going to prom, going to the dance, going to my baseball games? And they're not necessarily worried about long term, so to speak. It's right now, it's all about me. Very egocentric, very about forming their identity, very much into fitting in and feeling connected to their peers and their classmates. They don't want to feel different from their peer group. Because we all know, adolescents do. If one friend in their clique does it, the other friend or everyone else is going to do it. My mom used to say, if they painted their legs green, would you paint your legs green too? And I would say absolutely. So, we want to make sure that we are engaging with adolescents. They want to be treated like adults. They're still in that transition period between childhood and adulthood, but to speak with them as completely and openly and honestly as possible, and provide these opportunities to express their frustrations appropriately. So, whether it be to designate a supportive figure outside of the immediate family. So let's look at, a friend. Let's look at a mentor or someone that's not mom, dad, grandma, grandpa, someone who they're super, super, super close and with every day, but someone that they can go to and feel trust and establish that trust with and feel that connection and have an outlet to vent and talk. Giving them the ability to express their thoughts and their feelings, whether it be through music, through art, through sports, through journaling, through writing, different things like that. Again, giving them these positive outlets for coping. We also want to involve adolescents in the care and decision-making as much as possible. So incorporating them into these medical discussions with regards to their brother or sister. So, this is what's going to be happening, this is what's going to go on. What would you like to see with regards to, who's taking care of you, or who's going to take you here, or who's going to do this? Are there some things that you want to be involved in with taking care of your brother or sister? And thus giving them realistic choices as much as possible. So, when they have that sense of control, when they have those choices, they definitely feel more connected and they don't feel as angry and as resentful and as isolated from everything that's going on. So just giving them that ability to feel part of that process, I think, is really important for any child, any sibling of any age. So that kind of wraps up talking how to support siblings. So we have like 10 minutes left. So any questions for either Jenny or myself? Yes.
Let me remind.
Okay.
Not everybody in the back can hear, and plus we're recording, so that's all right.
I have 2 questions, if that's okay. And first, just say we love Child Life. You guys make a world of a difference, so thank you. First question is, so a lot of Child Life comes when there's like something physical that's painful, but I've noticed that a lot of the stress that my children get from being medically complex or whatever, it's from actual doctor's visits, because they have to sit there and they have to listen to everything that's wrong with them and everything that's not improving or everything. And, you know, I am amazed at how much more they understand than I give them credit for, and they don't talk about it. So I try to get them out of the room, but most of the time that doctors can't accommodate that. So do you guys have any suggestions for that? And I forgot my second question, so I'll just go with that.
Okay, that's okay. You know, and that is hard, because when you're sitting in those little rooms that you're kind of confined to them. And so, you know, for younger kids, having them bring activities with them and they can engage in that. But for older kids, you know, they can't, they're listening. And regardless of a visit or in the hospital, kids hear way more than I think a lot of times we give them credit for. You know, and so including them in the conversation and making it very well known, calling ahead to the doctor's office and say, my son or daughter's coming with us and he really wants to be a part of the conversation. You know, have that talk with your physician separately, even to say, using language that he or she will understand, allow them to ask questions, especially through school age adolescents. There's no reason that they shouldn't be involved. And, you know, a lot of things are said using medical terminology that they may not understand. And so setting that expectation before walking in, that we want this to be a family visit. We want it not to just be talking to mom and dad. Let's talk to all of us together. Let them ask questions. Right then and there, talk about if they're feeling anything. They might say no, you know, just like we talked about before, the doctor saying, do you have any questions? No, when their mind's probably spinning. And so even then, if it's following up with you later or with someone else that they tend to have a good relationship and build trust with, in the car on the way home, you know, did you hear anything that you want to talk about? Journaling's always a good one too, just to get it on paper. Do you have any other?
I'd say, you know, letting them artwork at home. You know, just saying, you might not want to talk about what the doctor, you know, what we just heard at the hospital, but do you want to draw a picture? Do you want to write a song? Do you want to sing a story? Do you want to play music of how you're thinking, how you're feeling, how that made you feel? You know, do you want to...
How old are?
Yeah.
6 and 3.
6 and 3.
Okay.
And they both have medical problems.
Okay. Yeah.
And your 6-year-old, I think you start incorporating more of those expressive things. I think your 3-year-old, a good outlet would be using like medical play. So like a doctor's kit with a baby doll or a stuffed animal or things like that, and letting them act out what their experience was and take on that role. And you might see some aggression and some, you know, kind of stabbing or hitting or things like that, but that's their way of expressing themselves. Kids a lot of time, depending on their developmental level, aren't able to verbalize, you know, exactly, well, I think this or I feel this. But you see it that, you know, by letting them go outside and kicking a ball, or a lot of times when I'm working with siblings and they go visit their brother or sisters for the first time and they come down the sibling center, they go straight to the air hockey table and they are hitting that puck really, really, really hard. And that's their way of getting out that, you know, this ticked me off, and, you know, I feel just kind of inside, and they get that release. So enabling them, you know, maybe letting them throw a Nerf ball or a Nerf gun, or, you know, as Jenny mentioned, like target practice at a bullseye or things like that. So that's really good for preschoolers to get out their frustration. They might not be able to say it. With your school ager, you can start looking at doing more like expressive things. Draw how you feel about this, or draw what, you know, how you feel about what the doctor or nurse said to you. So.
So that when you mentioned the doctor, so part of the problem too is sometimes you prepare and you all this stuff, and then you get the really rude phlebotomist who is not having a good day. Yeah. Or I just had the really rude MRI technician who told my child how horribly he was doing. Yeah. You know, so, and whenever I get a little iffy and like that, then my 6-year-old who's very anxious gets even more anxious because mom is anxious. Any suggestions on how to deal with the medical people who...
A lot of it, And that's always like, you wish you could have more control over that situation, and it's going to happen, and it's kind of just being aware that it's going to happen and try your best not to let it get into your plan that you've thought of with you and your child, that you've talked about outside of that setting and you've talked about on your own, and stand your ground. Like, that's hard, and we advocate for the parents so much. If your plan was to be a part of it or to do a comfort positioning for the blood draw or anything like that, stand your ground and do it. That you want to, if you come up with a plan, try your best to stick with it, using those same deep breathing techniques we use with the kids, use for yourself. Because it's hard and it's out of your control, and chances are it's going to happen more than once, and probably multiple times. And so kind of sticking with that original plan as best that you possibly can.
One is, for the majority of us that have had kids that have had, these illnesses all their lives, I don't think the stress gets better, no matter what kind of skills we're teaching them, who we're bringing them to, what they're learning. Something will work for a while, then we'll stop. Like, for example, my son, it's, so much stress. And wanted to know, what do you recommend, I don't recommend, for that? I mean, these kids, what do you do? Just keep teaching them new skills, but the kids are so stressed, even though they know where they're going, who they're going to see, what's going to happen. And it's like they know too much. They know about everything, the needles, everything, but they're so stressed even before they get there. I mean,
right, and a lot of times, a lot of these techniques work great for kids who are coming in and out of the hospital real irregularly or quick, or they've never been in the ER before or something like that. Chronic, it's a whole different issue. And so sometimes, having a totally separate outlet of someone that they can talk to outside of the hospital, because the hospital has become super familiar to them. So it's not an anxiety about strangers or the procedures that are going on. They've learned them. They could probably teach them or do them themselves. So giving them outlets of just other people to talk with, even, because I think as kids get older and the stress has built up, the biggest thing is making sure it has a way out, that it's not just building up higher and higher internally, that they have a go-to person to talk with outside of the hospital.
Well, I agree. Like, he has a cognitive therapist now, and they teach them skills and stuff like that. But what I'm saying is, most of these kids, the skills seem to stop working, and because they are chronic, the stress levels, I think, just exacerbate whatever's going on. And my other question was, you had said for the adolescents to find some other adult for them to talk to besides the parents. Why is that? And what is the reasoning behind that?
With adolescents, they look at mom and dad as sometimes quote unquote uncool, or mom and dad is the person who is going to ground me, or not let me take the car, or not let me go on a date with this person. So they don't necessarily see mom and dad as a friend, as a confidant. So with adolescents, what they want to really do is feel a connection with someone, feel like they can relate to someone on a peer-to-peer level, or even on a mentor-mentee level. So they're looking for someone who, isn't going to enforce these rules on them, because that's what ticks adolescents off, is the normal everyday rules and routines that mom and dad put on them that make them mad. Curfew, different, getting your homework done, things like that. It's not the larger picture that they're looking at. So that way that they have someone outside of mom and dad, that helps them have a more rounded relationship with that person. Does that make sense? That, they have someone who's not enforcing what I can do, what I can't do. But this is just someone who I feel safe and I feel comfortable with, that I can go and talk to, who's, not going to judge me, who's not going to look at me as a son or a daughter, but as a person, as an individual, and really understand me and where I'm coming from and listen to me. Is that helpful?
Yeah, sort of,
Okay.
kind of, yeah.
Okay.
I don't really have a question, just something to touch on that I didn't feel you guys talked about. But I have found we have been able to use Child Life in a hospital setting before, and a lot of the parents here have not had that opportunity. And what I felt was beneficial from you all is that us parents, when we spend a lot of time in the hospital, we get in this funk, and we don't necessarily put our efforts as much into our children, like paying attention to them, because, you know, we're in the corner, we've been there for months, we're not moving. But you all come in and you spend that one-on-one time with the child, whereas we're just in this mental state where we're not able to. So, I mean, sorry not to get choked up, but, you know, it helps a lot.
Thank you. There's someone in the back.
I have a screamer. She's 18 months old, and she screams when she just walks in an office. If I go to the doctor, she's already screaming. Do you guys have any tips for really little bitties? Just to, I mean, she has a lovey, she has a passy, but she's getting to the point where she can do the bubbles in the books, but we're still at the screaming stage.
Right. And you know what? And the lovey and the passy are the big things.
Yeah.
Bring the things that they're familiar with from home. This sounds kind of ironic, but there are a lot of great apps for infants on the iPad if you have that available to you. You know, not that you want to get them totally like zoned into watching TV, but different soothing ones, infant soothers with just the kind of developmentally appropriate images and sounds and lights when they would need it. And, you know, sometimes for blood draws and sticks for infants in the hospital, we'll use that even as just comforting music for them. You know, it sounds like at 18 months, she's already getting used to knowing that it is the doctor's office, that she knows it even when you go. So comfort positioning is a huge one. You know, it's very vulnerable for them to have to lay on a exam table or a bed. I'm sorry, I can't see her right then. I felt rude. But really to just kind of swaddling, holding, she's probably starting to kick and go crazy, but as much as you can kind of get in a position that's more comforting for her, whether it's like belly to belly hugging or just different positions that you come to find are more comforting, because the minute that they're set on an exam table or put in that gown, you know, it throws them for a loop and they're instantly going to start screaming. Any others?
I would, you know, as she gets older, one of the things that our music therapist, one of our music therapists incorporates, and I think this maybe looking at when she starts getting into preschool age, is she says to the kids, you know, wow, you have a really great voice, a really loud voice. And, you know, we know that you can use that voice to let us know how you're feeling. So let's try, instead of being as loud to let us know how you're feeling, let's see how soft your voice can be to let us know how you're feeling. And it's kind of like reverse psychology. So instead of us using our really loud voice, let's try and use our quiet voice to say how we're feeling. So we can just go, like that. But also just validating for her, you know, letting her know, and this is one of the big things we let kids know, is that it's okay to cry, and it's okay to scream, and it's okay to use, you know, your voice to let us know how you feel. So validate, because so many hospital clinical staff will say, oh, don't yell, don't cry, don't scream. We want kids to know that it's okay to feel that way, and it's okay to be angry, and it's okay to be scared, and to, you know, to use those behaviors in that outlet, but maybe start trying shifting them, redirecting them, if that makes sense.
And as a parent, knowing it's okay that they're screaming too, because you're not the only one that has a screamer.
No.
And a lot of, you know, they're going to scream. Let them scream. It's going to happen.
Yeah.
How fast can you get them back to baseline once you're done? You know, the screaming's going to happen, the crying, the kicking, it's going to happen. Quick bring in that favorite toy or whatever it is once they're done and get them back to their baseline, because that's really one of the most important things, is that once it's done and over with, you're walking out, she's back to feeling good, because she'll grow into the next stage then.
I don't know if you mentioned it, but sometimes in certain hospitals, like they won't even bring a child like explain for certain things, and then as a parent, you can always ask and wait for that person.
Yeah,
Absolutely.
definitely.
Before, so they don't show up, and I'm like, I can't, you know, I'm waiting for the child like person to show up.
Yep. And always, that's what we were advocating for the parents. It is completely your right to say who you want in that room, what's your child's best coping mechanism. If it's child life, could you please wait for them until they arrive? If it's certain materials, we need to bring this, and this with us.
It's numbing cream.
Yeah, numbing cream, anything like that.
Just wondering if you had any tips or strategies to do with very specific fear. So my daughter's 3.5, and we've kind of narrowed down exactly what she's afraid of, and it is the doctor table. So she's okay if she's sitting on a chair, she's okay to be in the room, but as soon as someone asks her to lay down, she is very anxious, fearful, cries, screams. And sometimes they are able to accommodate that and have her sit to do whatever they're doing, but there's sometimes that they need her to lay down. Is there any specific things I can do to work on that with her? She's had a lot of traumatic things happen to her while laying down, and I understand where the fear is coming from, and I don't know, how to get that out of her memory,
Right.
so that, because it's not always bad or painful when she's laying down, and I've talked to her about it and just said they just want to feel your tummy or they just want to listen,
Right.
do this, and it's not going to hurt, but she's still at that age where she doesn't trust, right? 'Cause so much has happened.
Mm-hmm.
So do you have any specific strategies to get her to kind of get over that hump, I guess?
Right. I think you named the biggest one, that when possible, to use the different comfort positionings in your lap, different things. But you're right, it's not always possible to do. There is a time if they need to look at a certain way that they need them laying down. So the number one, advocate for a comfort positioning in your lap or something. But then go with play, use her dolls. And when you're just at home, have the dolls have to lay down, talk it through. Why do they have to do that? Make up the scenarios. They have to lay down just to check their belly and play it through, Come up with a plan when you're in the safety of your own house, not at the office. The next time you have to lay down, what do you want to lay on? Should we bring something special and have a special blanket that is only for laying on the doctor's table, or if she wants to use it for other things.
And do you think, though, if she does that and is able to kind of overcome that, and she lays down and she realizes it's not bad and does it a couple times, and then the next time they have to hold her down for blood work or a catheter or something like that, then it's all over again, right? Is that...
Right, and it's completely normal, and because those are occurrences and experiences that they feel threatened. They're laying down and they're kicking and they have to be held. And so, you try your best to avoid all those situations and try, for blood work to ask and say, can we please do it in a holding position rather than the vulnerable laying down position, where one of my favorites with blood work is really giving just the big hug and letting their arm go right off to the side, and you guys can both look this way and do your own thing over here and let the blood work happen over there. But a lot of it's repetition, especially with 3, that talking, being honest. Sometimes when we have to lay down, it's not going to be real fun things, but what can we do when it's done? Because we have to lay down, but let's make a plan then for when it's done. So talking through, and a lot of it is talking and playing in the safety of your own house, because it's in that moment you can't talk through it anymore, and you can't, well, let's lay the doll down. No, you're done. It's scary, it's stressful, so you have to do it outside of that environment.
Do you have tips for the nightmares that come after?
A lot of times, continuing with the talking and why do you think that happened and what did it feel like, have them describe it to you, because
she screams, and she'll scream in her sleep, scream and cry after in her sleep, and I know exactly what it's about because she screams the same words at the doctor.
Okay, so
and
she's
it's
got
usually right after a hospitalization or a procedure, and then we get it for a week or 2 after, where she's up every night screaming in her sleep.
Right after. Artwork is always a good one to kind of draw more, to have her tell you more, that you're hearing the same screams and you're hearing the same phrases, but go farther. Have her draw, what did it seem like in that room? Let's draw a picture and get going, talking about it. Do you have any other ones? Nightmares are hard because, you feel helpless in the middle of the night when there's the screaming going on, and so at 3, it's hard for her to verbalize. And so sometimes it's just that play, waking up the next morning. Do you want to play about going to the doctor? Putting it at their level, because they're not going to be able to say, what did you dream about? What do you think it meant? Let's talk that through. Play. Keep playing.
Pretend to be the doctor.
Yeah. Pretending to be the doctor, role reversal, let her be the doctor. And honestly, just kind of reminding constantly that she's safe, that you're with her, that the doctors they don't want to hurt her, and those reminders that she's safe, because sometimes that's what it comes down to, is they don't feel safe there, and it's scary. And at 3, you can't get into some of the bigger issues, but they know you're safe, you're okay, I'm right here. The repetitive reminders along with the play.
Okay, I think we're going to have to call it.
Okay.
Great.
Thank you.